It's 5:49 here on LEX 18 News at Sunrise. Coming up, your birthdays and anniversaries.
And Lee Cruz is speaking with Dr. Julie Swindler about weight loss at Medical Bariatrics of Lexington. Good morning to you, sir.
Good morning there, Tom. Good morning, dear. Yeah, if you're serious about losing weight, these folks, the experts here at the Medical Bariatrics of Lexington, can certainly help. They're off of Old Rosebud, which is in Hamburg. We'll give you precise directions in a moment. Got more news, traffic, and weather on the way as well as we continue with LEX 18 News at Sunrise.
And Lee Cruz is checking out the Medical Bariatrics of Lexington.
Yeah, it's a new place in town. It's designed to help folks lose a little extra weight. Morning, Lee.
Good morning there, dear. Good morning, Tom.
Hey.
We've got the folks from Medical Bariatrics of Lexington, Dr. Julie Swindler, who is heading the thing up. Hey, Doc, how are you?
Hi. I'm doing well. Thank you.
Who you got with you? Introduce
This is Dr. Alan Rader. He's my partner as well.
Good to see you again, sir.
Nice to meet you.
Now, what exactly happens with you guys? What is it you can do for your clients? What happens?
Absolutely. Well, we are bariatricians, which are licensed physicians who subspecialize in weight loss medicine. Now, most people, when they hear the word bariatrics, automatically think of the weight loss surgery. Yes, actually, absolutely. Well, that's because bariatric surgeons do bariatric surgery, but we're bariatricians, so we do non-surgical weight loss medicine, and that's what both of us have done.
Okay, so an example would be?
You come in, you visit, we do your medical history, we do your physical exam, and it's just like putting gas in your car. You have to know exactly the right type of gas to put in your car, the fuel for your engine. And based on your exam and your history, we can figure out what you may need as far as nutrition, and then the medicines that might be appropriate to help you get the disease, obesity, under control.
So it's an overhaul, essentially, of what's going in the tank, and then you give them a game plan from that point forward.
And that's very well put, and that's exactly why seeing a medical doctor is so important. It's just like the game plan of a game. Once the game gets going, sometimes the coach has to change the plan, and the medical bariatric specialist can evolve the treatment protocol as the program continues.
So with an evaluation, you guys sometimes may find another cause as just opposed to overeating that may determine why this person cannot lose weight?
Absolutely. We see all the time. We look for things that a lot of people would think we would look for, like are they diabetic, do they have low thyroid? But there's also really big differences between normal thyroid and optimal for weight loss. And there's lots of other causes too, such as insulin resistance that could be blocking their weight loss. And by us taking a look at laboratory and other items, we can see if somebody is suffering from that, and if they are, help fix it, and that oftentimes helps them lose a good amount of weight.
All right, now guys, we'll talk about some of the methods that they use and look at the tools that they have here at the Medical Bariatrics of Lexington when we come back.
Awesome, Lee. Thanks very, very much.
Thank you.
Forecast is beautiful. But first, Lee Cruz is at Bariatrics of Lexington with the latest in weight loss. Morning, Lee.
Good morning there, dear. Good morning, Tom. We're talking with the experts here, and of course, they can do a total body analysis to get you on a weight program. Hey, that tickles. When, as a matter of fact, they use one machine we're going to show you. Excuse me, Dr. Swindler. Look at this thing right here. I know what you're thinking. What's wrong with that rascal? Where's the wheels? Well, when we come back, we'll show you how this thing works in a moment. Plus, more news, traffic, and weather on the way, too, as we continue with LEX 18 News at Sunrise.
With coverage you can count on, this is LEX 18 News at Sunrise.
Lee Cruz is checking out Medical Bariatrics of Lexington.
Yeah, they're using the latest in medical knowledge to help their clients drop the pounds and keep them off. Morning, Lee.
Morning, guys. Yeah, you're using pretty much what is the latest in medical techniques to help you get to a safe weight, or the appropriate weight that you should be. And we ran the numbers for me. Dr. Julie Swindler has this in her hand as you're looking, and you know, I'm not that pleased with it, but I guess I'm okay, right?
No, you look great. You do the InBody 520. It's one of the best bioimpedance devices that's out there on the market today.
That's that machine that we saw here. It looks like the go over and call. You're looking at the machine. It looks like a rascal gone wild. See that thing? You stand on it. You take your shoes, socks off. You stand on it, and you hold the device, and then it gives you a body composition.
Absolutely. It lets us know, not only what your current weight is, but the percentage of you that's body fat. It looks at the water, and is it inside your cells where it's helpful? Is it out of the cells? Is it the total body water? How does that compare with the rest of your weight? Because certain percentages are needed actually for a weight loss. So if you're not drinking enough water, we can actually tell you're here. It looks at something called a body mass index, which takes into consideration your height with your weight, puts it into an equation, then a scale. And then I can also look to see, you know, where is your lean muscle mass? Do I need to increase it in any particular place to help with the weight loss?
Well, since my body fat is a little bit too much, just a little tiny too much, what I'm going to do is stretch myself out to get more height. And then that would probably, the numbers then would work in my favor. Is that, if I were, say, 5'10" or 11 instead of 5'8", I'd be in good shape.
Well, that would work for the body mass index part, because that's the only part that considers the height, but the body fat actually measures it.
But then you guys use this as a game plan, and then, of course, you go forward from there. All
Absolutely.
right. Now, when we come back, guys, we're going to tell you more about what they do here at the Medical Bariatric Center of Lexington, located in Hamburg. It is off Old Rosebud. They sort of, they're close to what they...
Look for the bank.
Yeah, look for the big bank. There you go. That's across from Drexel Heritage. That's right.
Hey, Lee.
Hey, what?
Is it covered by insurance?
I don't know. That's a good question. You guys have, is this covered by your insurance on occasion, or?
Some insurances, some do. In fact, the only way to really know is for them to call. A lot of insurances, unfortunately, aren't ahead of the game, and they don't. But what we do for every patient is we'll print them out a super bill that lists all of the diagnoses codes, and if their insurance is progressive enough to reimburse them for it, then they can get reimbursement.
Very good. Awesome. So there you go. Yeah.
Awesome.
Why not be preventative, guys?
Hey, you know, if you just lay off that Cracker Barrel every once in a while, you wouldn't have to stretch yourself out.
You leave the Cracker Barrel alone. Keep your mouth shut down there.
I like the Cracker Barrel too. To you guys. Let's go see Lee.
Yeah, he's out with the folks at Medical Bariatrics of Lexington with more. Good morning to you, sir.
Good morning there, Tom Dia. Yes, this place is located off of Old Rosebud, which is in Hamburg. And what we're talking about is bariatricians, and that's what Dr. Rader is. And a bariatrician is not a guy who just loves Frankenberry cereal. He's a guy who is, of course, specializes in weight loss. And you, as I understand this, were the #1 bariatrician for 2007?
Yes, thank you. Our National Society of Bariatric Physicians annually gives out an award, and I was elected as the National Bariatrician of the Year for 2007, partially in my work at the national level in training other physicians, and partially in response to our treatment protocol that's been used in over 8,000 patients now. The very same protocol in treatment that we've taught to Dr. Swindler, and she uses in our office here in Lexington.
There she is right there. Congratulations on that.
Thank you very much.
That's
Thank
very
you.
good. I came in 5th. Now, here's the thing, and this is an important little nugget of information you should give folks. If everybody talks about exercise, but it really comes down to nutrition. And there's some numbers you can throw at folks.
Well, it's actually, we were talking about it during the break. If you eat just one M&M, you have, not a pack, one M&M. One.
Tiny, teeny tiny.
You have to walk a football field to burn it off. We like to think of weight loss as a nutritional problem, and exercise being most important in weight maintenance. We teach you don't exercise to lose weight, you lose weight to exercise.
If you were to walk from here to Richmond, what is that?
Half a pound. Half a pound
That's
is
it.
all you would lose. Half a pound.
If you were to walk from here to Richmond, Kentucky. That's incredible. Now, if folks want to learn more, they can call you guys, Dr. Swindler. What's the phone number?
Absolutely. 263-SLIM, 7546.
All right. Thanks for having us out. We certainly
Well,
do
thank you so
appreciate
much.
it. Dr. Rader, good to meet you, sir.
Thank you. Appreciate you being here.
Guys, that'll do it from the Medical Bariatric Center here in Lexington.
Bye-bye.
Have a good weekend, Lee.
Okay. we'll see
30
you.
Rocks, Tina.